Okay, for this session, we're going to look at how ultrasound can be used to evaluate the airway, and specifically looking at the trachea, the vocal cords, the cricothyroid membrane, and potentially identifying the esophagus. So ultrasound in those structures, we should talk about, since they are very superficial, we can use a high frequency probe. So a linear probe is the ideal probe in this examination. We want to start off in looking at a transverse approach because that will give us the easiest way of letting our probe rest on the neck and identify the trachea and evaluate for the presence of the esophagus, either lateral or just behind the trachea. Often we are able to visualize that with ultrasound. So I'm going to start off by sternal notch. Here's the cricothyroid membrane, and we want to place the probe somewhere in the middle of that space right there, or approximately 2 centimeters above the sternal notch. Start off with the probe again transverse to the neck, as this, and we're going to identify here, increase our depth slightly, we're going to identify our trachea. We see the hyperechoic reflection of the cartilaginous rings of the anterior aspect of the trachea, and then we're going to look and scan. The indicator here is the patient's left side, and we're going to look to see for structures that potentially could be the esophagus. And this is the esophagus right here, just lateral to the trachea. So the transverse position is great to identify the location of the trachea. You can scan up and down, and when it comes to intertracheal intubation, this is the technique we look to see as we're deflating the pilot balloon to evaluate for deformation of the anterior aspect of the trachea to show the location of that intertracheal tube cuff, which would potentially show appropriate or inappropriate position of our intertracheal tube. But again, here we see the esophagus very nicely lateral to the patient's left side, as which we know about 40% of the time patients' esophagus are lateral to the trachea, and in that 40%, 90% of the time it is to the patient's left. So here we have a great view of the esophagus. So from this position, and starting transverse, we want to identify the trachea, and again we can practice scanning up and down. As we scan towards the head, we will identify a step up where we see now structures become more anterior to the probe, and the anatomy changes. So now we are going over cricoid cartilage, and now we've just gone past the cricothyroid membrane shown here, and to the level of the vocal cords as we scan up higher. We can even ask our subject to say E, and you can see the motion of the vocal cords quite nicely in this picture. One more time if we say E. So again, just scanning in a condad to now cephalad direction, we can see the various structures. And as you practice this in the transverse approach, you can identify all the anatomy, including the cricothyroid membrane. But a helpful technique is to get a long axis view so you can see all the airway anatomy in the same image. So I would encourage, start off about 2 centimeters from the sternal notch, and now rotate your probe such that the indicator is now at the 12 o'clock position. Find some strategy to stabilize your hand because you'll find it very easy to rock away from the trachea itself, and keeping it midline is a little bit tricky, but if you rest your hand on your patient, that will provide the stability needed. So now we have a long axis view of the airway, and the structures that we're seeing here, these are the tracheal rings. We see the initial step up here, the cricoid cartilage. This is the cricothyroid membrane, and if I scan up a little bit higher, this is the thyroid cartilage. So cricoid cartilage, tracheal rings, thyroid cartilage, and right here is the cricothyroid membrane. So 2 strategies, starting off with a transverse approach to get identification of the trachea, useful again to evaluate for the expansion or alteration of the shape of that trachea. If we have an intertracheal intubation, we're trying to identify the pilot balloon of our, the balloon of our intertracheal tube. It's a useful technique to just scan up and down in the transverse approach. You can also identify the esophagus in that technique. But then to evaluate for cricothyroid membrane, usually is advantageous to scan in a long axis fashion by just rotating it to the 12 o'clock position to get the ultrasound probe sitting on top, so you can see tracheal rings, cricoid cartilage, cricothyroid membrane, and the thyroid cartilage. Great.